Asthma. It's a word that can evoke feelings of worry, even fear, but knowledge is power. Understanding asthma is the first step in taking control and living a full, active life. This guide will equip you with the knowledge and tools to manage your asthma effectively. We'll explore what asthma is, why it's vital to manage it, and how you can live well with this condition. Asthma is a chronic respiratory disease that affects your airways. These airways are like the pathways that carry air in and out of your lungs. When you have asthma, these airways can become inflamed and swollen, making it difficult to breathe. Imagine a hose with a small diameter. Now imagine trying to push a large amount of water through that hose. That's similar to what happens during an asthma attack. The narrowed airways restrict airflow, leading to those familiar symptoms: wheezing, coughing, shortness of breath, and chest tightness. But here's the good news. Asthma is manageable. With the right information and proactive steps, you can live a full and active life. This guide will provide you with the knowledge and tools you need to breathe easier. To truly understand asthma, let's take a closer look at what happens inside your lungs. Your airways are naturally very flexible, expanding and contracting as you breathe. However, when you have asthma, these airways become overly sensitive. This hypersensitivity is often triggered by things you might not even notice: pollen, dust mites, pet dander, or even cold air. When you encounter a trigger, your immune system overreacts. This immune response causes inflammation and swelling in the airways. Picture this. The lining of your airways becomes inflamed, like a swollen ankle. This swelling narrows the airways, making it harder for air to pass through. In addition to inflammation, your body produces excess mucus, further clogging the airways. This combination of inflammation, mucus production, and muscle tightening leads to the classic asthma symptoms. By understanding these underlying mechanisms, you can better appreciate the importance of managing inflammation and avoiding triggers. Asthma is not a one-size-fits-all condition. It manifests differently in each individual, and understanding the various types of asthma is crucial for effective management. While the underlying mechanism of airway inflammation remains constant, the triggers and severity can vary significantly. One of the most common types is allergic asthma. This type is triggered by allergens like pollen, dust mites, pet dander, mold spores, and certain foods. If you have allergic asthma, your immune system overreacts to these otherwise harmless substances, triggering an asthma attack. Another prevalent type is exercise-induced asthma. This type typically occurs during or after physical activity, especially in cold, dry air. The rapid breathing during exercise can irritate the airways, leading to symptoms like coughing, wheezing, and shortness of breath. Occupational asthma is another form triggered by substances encountered in the workplace. This could include chemicals, dust, fumes, or even animal proteins. Identifying these workplace triggers is essential for preventing asthma attacks and ensuring a safe work environment. By understanding the specific type of asthma you have, you can work with your doctor to develop a personalized management plan that addresses your unique triggers and symptoms. We've touched upon some asthma triggers, but let's delve deeper into these environmental factors that can set off your symptoms. Identifying and avoiding your personal triggers is crucial for managing asthma effectively. Some of the most common culprits include allergens. These are substances that trigger an allergic reaction in your body. Common allergens include pollen, dust mites, pet dander, mold spores, cockroaches, and certain foods. Irritants. These substances irritate the airways, leading to inflammation and symptoms. Common irritants include tobacco smoke, wood smoke, air pollution, strong odors, and fumes from cleaning products. Weather changes. Sudden changes in temperature, especially cold, dry air, can trigger asthma symptoms. High humidity can also be problematic, as it promotes mold growth. Exercise. While exercise is generally beneficial, it can trigger asthma symptoms in some individuals, especially in cold, dry air. Infections. Respiratory infections like colds, the flu, and sinus infections can irritate the airways and worsen asthma symptoms. Stress. Emotional stress can also be a trigger for asthma, leading to increased inflammation and symptom flares. Identifying your triggers is like solving a puzzle. It requires careful observation and often the help of your doctor. Section 5. The power of an asthma diary. your personal detective. Now that you're familiar with common asthma triggers, how do you pinpoint your personal culprits? This is where an asthma diary becomes your secret weapon. Think of it as a detective's notebook, helping you track down those elusive triggers. An asthma diary is a simple yet powerful tool for managing your asthma. It helps you identify patterns and potential triggers, allowing you to take proactive steps to avoid them. By keeping a detailed record of your symptoms, activities, and environmental exposures, you can gain valuable insights into what sets off your asthma. Here's what to include in your asthma diary. Date and time. Note the date and time of each entry. Symptoms. Describe your symptoms in detail, including their severity. Medications. Record the medications you took, including the dosage and time. Activities. Note your activities before and during the asthma episode, such as exercise, exposure to allergens, or encountering irritants. Environment. Describe the environment you were in, including the weather, indoor air quality, and potential triggers like pollen, dust, or pets. Peak flow readings. If you use a peak flow meter, record your readings regularly. Notes. Add any other relevant information, such as your mood or stress levels. By diligently maintaining your asthma diary, you'll gather valuable data that can help you and your doctor identify your triggers and adjust your treatment plan accordingly. Section 6. Outsmarting your triggers: practical avoidance strategies. Identify your asthma triggers with your asthma diary and implement strategies to avoid them. Here are some effective avoidance strategies. Minimize allergen exposure with dust mite covers. Vacuum regularly using a HEPA filter vacuum cleaner. Avoid smoke, including secondhand and wood smoke. In cold weather, cover your nose and mouth with a scarf. Control indoor humidity to prevent mold growth. Be proactive with pets. Keep them out of the bedroom and bathe them regularly. By minimizing exposure to triggers, you can reduce asthma attacks. Section 7. Asthma medications. Your arsenal for breathing easy. While avoiding triggers is crucial, medications often play a vital role in managing asthma effectively. These medications work by reducing inflammation, relaxing airway muscles, and opening up the airways, making it easier to breathe. Your doctor will prescribe the most appropriate medications based on the severity of your asthma, your triggers, and your individual needs. Asthma medications can be broadly classified into two categories: inhaled corticosteroids. These are the most common long-term control medications for asthma. They work by reducing airway inflammation. Examples include fluticasone, Flovent, budesonide, Pulmicort, and beclomethasone, Kuvar. Long-acting beta agonists, LABAs. These medications relax airway muscles and are often used in combination with inhaled corticosteroids. Examples include salmeterol, Ceravent, and formoterol, Foradil. Leukotriene modifiers. These medications block the action of leukotrienes, substances that contribute to inflammation and airway narrowing. Examples include Montelukast Singulaire and Zafirlukast, Accolate. Short-acting beta agonists, SABAs. These are quick relief medications that relax airway muscles, providing rapid relief from asthma symptoms. Examples include albuterol, ProAir, Ventolin, and levolbuterol, Xopenex. It's crucial to understand that controller medications are taken daily to prevent asthma symptoms, while rescue medications are used as needed to relieve sudden symptoms. Section 8. Mastering inhaler techniques. Getting the most out of your medication. Using your inhaler correctly is just as important as taking the right medication. If you don't use your inhaler properly, the medication may not reach your lungs effectively, reducing its effectiveness. There are different types of inhalers, including metered dose inhalers, MDIs. These are the most common type of inhaler. They deliver a specific dose of medication with each puff. Dry powder inhalers, DPIs. These inhalers require a forceful inhalation to deliver the medication as a dry powder. Examples include Advair, Spiriva, and Brio. Nebulizers. These devices turn liquid medication into a fine mist that you inhale through a mouthpiece or mask. Your doctor or pharmacist will show you how to use your specific inhaler correctly. Here are some general tips. Shake the inhaler well before each use. Breathe out slowly and completely. Place the mouthpiece in your mouth and close your lips tightly around it. Press down on the canister and inhale slowly and deeply. Hold your breath for 10 seconds to allow the medication to reach your lungs. Rinse your mouth with water after using an inhaled corticosteroid to prevent oral thrush. If you're unsure about your inhaler technique, don't hesitate to ask your doctor or pharmacist for a demonstration.